We want to welcome you here this morning and thank you for being here and to help us communicate and tell our community where we are on this issue of a communicable disease such as the H1N1 flu virus that's been talked about throughout the country. My job here today is to introduce Mr. Olivarez, Eddie Olivarez, our health director, who will be giving you specifics. But generally speaking, our message is one of prevention. So far, we've had confirmed 24 cases of this disease, H1N1. That we have had 5 fatalities, 1 7-year-old child, 4 adults. It's an issue that needs to be looked at, and we need to be careful. And Mr. Olivarez is going to be giving us the community some suggestions that they can use to hopefully be able to prevent this disease from affecting them. Eddie?
Yes, sir. Good morning, everyone. My name is Eddie Olivarez. I'm the Chief Administrative Officer for Hidalgo County Health and Human Service. And today I'm here on behalf of Judge Garcia and Hidalgo County Commissioner's Court. We have, of course, Oscar Montoya, our Emergency Management Coordinator for the County of Hidalgo. Just to give you all an update, I know there's been a lot of inquiries in regards to H1N1 in regards to the flu. Let me give you, these numbers are going to be generated since Thanksgiving, approximately the end of November to now. We've had 24 cases of H1N1 PCR confirmed. PCR is a laboratory analysis that is done that would 100% confirm H1N1. So this is 100% defined as a case. So we've had 24 cases since the end of November. We've had 13 people hospitalized since that time period to now. The hospitalization could be from an average stay just to go get assessed to some critical levels of hospitalization needed. We've had, as of just a few minutes ago, actually, the number changed a little bit. We've had 6 fatalities. We've had 1 pediatric case, and we've had 5 which are adults that are older than 25. The average age of those has been actually in the 30s. We've had a 27-year-old, 33-year-old, 35, 39, 50, and 56. So if you average it out, it averages to the high 30s. So this is an adult age group. All of them have had pre-existing conditions dealing with other major illnesses. None of these folks died from H1N1 exclusively. The primary diagnosis was either a diabetes, advanced cardiovascular disease, in the event of an organ transplant. And unfortunately, H1N1 attached themselves to them once they were dealing with their primary illness. And it could have happened in many forms. It could have from the household, from the community. It could have happened in many different forms, how that could have attached to them. So out of those fatalities, that's what we're looking at. But let's look at the preventative side. I'm very proud of the direction Hidalgo County has gone forward. As a county, through the direction of Judge Garcia and the Commissioner's Court, for our employees, we've done over 1,000 vaccinations for our county employees. That's over 1/3 of our actual total workforce have been vaccinated for flu. In Hidalgo County, through our TVFC program and our over 200 physician partners, we've given over 40,000 vaccines, primarily to children and adults, but the largest focus area would be children. We've worked very carefully with that. We have given a series of educational support led by Stevie Hinojosa, our epidemiologist for the county, on notifiable conditions and workshops and training that we've done with the various physicians, hospitals, infectious disease, surveillance officials within the community and the hospital system. That has been done as well. The other thing that's real important to help explain to the media is that flu is not a reportable illness. The flu illness is not required to be reported like a measles or mumps or diphtheria case. The only requirement is in the event of a pediatric fatality, in case we have one, that is the only thing that's reportable to the state. So it is very difficult for us to get accurate numbers because it's not required to be reported. However, we are taking on the case of active surveillance, and we're one of the few counties in Texas that's doing a very active surveillance component led by our surveillance team through Hidalgo County Health, where we actually contact the physicians, contact the hospitals, and do our active surveillance to get a better idea of what we're dealing with. And the reason we're doing that is that will actually give us a direction in how to focus our preventative education. If we know we have specific illnesses in a certain age group, for example, elementary schools, we would do an extra focus in dealing with the school districts. We would really focus in on those areas. So this active surveillance gears us in a direction to be able to provide ongoing and more expanded prevention, education, and awareness to make sure that we keep this flu situation contained. From that perspective, that's what we're looking at. Another statistic that's very important is in the United States alone, 24,000 people die a year from flu or flu-related illnesses in the United States. If we were to extract that statistically and pull it out for 800,000 people here in Hidalgo County in our population, we would average between 11 to over 100 deaths a year. If you were to pull just from a statistical point of view, that's what we would average depending on the year. So at this current rate, it is not an unusual number statistically speaking. We feel terrible for the family members, the loved ones, and the people that are related to these losses in the community. But from a public health point of view, this is nowhere near an epidemic or a major outbreak. By no means, it's not there yet. So I think one of the main factors that we need to look at is really focus in on the 4 C's. And the 4 C's are clean your hands with soap and water, antibacterial soap preferred, cover your mouth when you sneeze and cough, contain yourself. If you're running an illness, if you're running a low-grade fever of 99, 100, 101, make sure that's when you're the most infectious. Stay home from work, stay home from school. And most importantly, the last C, consult a physician. Go see your doctor. Find out exactly what you have. There's a lot of other illnesses going on. We have a concern with upper respiratory infections that are going on here in South Texas. Very serious concern. Those get confused with H1N1, but a lot of times the respiratory infection comes in first, and then H1N1 attaches itself to that, and it just complicates things more. So it's very important we follow through on those. You could get your flu shots with your local physician, pediatrics, family doctors, your local pharmacist, your local pharmacy groups. The range of vaccine would cost from $15 to $35. It's a very inexpensive preventative measure to avoid getting ill. Many children qualify for vaccinations at a either free or very reduced cost. So it's very important that we follow through with the preventative efforts within our community and making sure that we all do our due diligence to keep this illness in check. When you look at it from a community perspective and an economic perspective, economically from a workforce entity, if we have a healthier community, a healthier residency, it's important that those folks provide back to the community. What would happen if you had the majority of teachers were out ill? You would have a very difficult situation from an economic view for a school district. Or in the case like Mr. Montoya, he works very closely with all the emergency operation people. So if you had your police force, your fire force, if there were a majority who were out ill, that will lessen the response time in the community. So that's why it's very important that we look at flu prevention as a way of assuring the safety and security of your community from a larger, more global point of view. I'm open to questions, Judge, unless you want to add, Mr. Montoya, would you like to add something from an emergency manager perspective?
Part of what we're doing also in communicating with our departments here in Hidalgo County, working with the health department, working with our PIO, also our risk department and our maintenance is to try to do even preventative stuff in our place of employment. And the businesses can help us out with this and the other governmental agencies. You know, things like cleaning doorknobs, wiping things down, you know, that people travel often. If you talk on a phone that other people use or that people borrow, is wiping it down before and after you use it. Those are little common sense things that we forget when we're going through our everyday lives. Washing our hands often. Lots of times, like you said, it's one of the C's. But if you don't remind your kiddos as they're going out the door on the way to school that they need to do that, rubbing their eyes, it's real important that you tell them. I don't know about y'all, but my kids, as they're leaving us, the first thing they do is rub their eyes, and every time they're doing something, they're rubbing their eyes. That's one of the main ways that they catch these viruses. So if they can just avoid that one time, then they're just lessening their chances. So those little common sense things are what we're asking people to do. If everybody does wipe down their doors, wipe down the places that people handle, take care of their telephones, if you lend out your cell phone, same thing, give it a wipe before somebody does that, or somebody sends a text on your phone. Those are little common sense things that we can do to keep our workforces going. We're making a big deal of that within the emergency services, and hopefully the government agencies and the other employment areas will do the same thing. Thank you.
One of the things, Oscar, right here, this is the easiest greeting right there.
Yeah.
I mean, because you're just keeping cooties away from each other. So also one of the things that's very important to look at, I've been getting calls, we've all been, the judge, myself, and Mr. Montoya has been getting calls in regards to confirming deaths in hospitals and in different locations. We cannot confirm the fatalities because, again, we're doing active surveillance. Unless we call and inquire about it, hospitals are not offering that information to us because, again, it is not a reportable illness unless it's a pediatric case. So we cannot confirm. A lot of you will call and say, we got a call that at X hospital someone died. We don't know that unless we call and inquire. And then if we do call and inquire, we have to have a justification because of HIPAA requirements. We have to have a reason to be able to call and inquire about that case, and it needs to be from a public health perspective. So they're not going to give us information just because we call. We got to go through procedures and protocols as well. So just bear with us and be patient with us on some of that because we have to follow the specific rules and laws as well. So it would be fair to say that the estimation of H1N1 would be greater than the 24, just from a statistical point of view. That would be an accurate statement. But again, the information we have is based on active surveillance, and therefore there may be cases that may be out there that have never been reported or we haven't found out about. Sure, that's possible. In 2009, Hidalgo County had 27 fatalities from H1N1 specifically, and had over 5,000 cases. Okay, we're not anywhere near that. H3N2 is the regular everyday flu. H1N1 is a specific type A flu. That's what seems to be the prevalent case. Now the good news is that our flu vaccine has had H1N1 preventative in it for the last 3 years. So your everyday flu shot actually has the preventative measures for H1N1, and it's appearing to be the dominant flu strain this year. Seems to be H1N1, and thank God that the flu vaccine that we have this year nailed it and hit it strong. It's actually helping prevent it. The flu vaccine will not stop the flu. It'll prevent it from it being totally, it'll just overwhelm you. It'll lessen the symptoms. It'll lessen the illness. It's very important to understand that. A lot of people think that, well, if I get the flu shot, I still got sick. Well, some people may experience some flu-like symptoms, but it's not the full-blown flu. And then the other thing is that you don't get the flu from the vaccine. The needle shot injection you get, it is a null virus. There's nothing in there. So that old myth that you would get the flu from getting a shot, that's not going to happen. Most of the time, people have already been exposed to the flu. And a lot of times people say, oh, I should get my flu shot because I'm feeling kind of bad. Well, it's 10 to 14 days incubation. So for those 10 or 14 days, you've been feeling pretty good. And all of a sudden, by the 10th, 13th, 14th day, you start feeling, and then, I got to go get my flu shot. You're already sick. The pre-existing conditions is a big issue for us, too. So these fatalities all had pre-existing conditions. So again, these folks were already ill. It's real important that you all stress that these folks had advanced diabetes. We have people who were on dialysis. We had folks who were extremely obese. Serious cardiac problems, and one I think also was going through a transplant, an organ transplant as well. So these folks are very ill. The ones that passed away are very, very ill. But at the same time, though, but you hit on a nail where we have a certain age group of folks that don't follow through with vaccines and preventative measures. And the thing is, when you're dealing with schools, I mean, come on. I don't know how many of you are parents, but when you're dealing with a 6, 7-year-old, they're always doing this, they're always doing that. They never wash their hands. Little boys are the worst, you know. We got to get them taken care of, especially at the schools. We have some real interesting software that we are able to track hospital admissions based on diagnosis and different types of illness. So Steve and his team, which is comprised of nurses and other health professionals, they're actually like they're like little CSI groups for public health. And they actually go and they start investigating certain illnesses that are out there, and they actually look at data coming in from the hospital, data coming in from the doctor's offices. We have over 800 physicians in Hidalgo County. Through our TVFC program, like I said, we've done over 40,000 vaccines in our community already. Probably actually closer to 50, but for sure a safe number, a good number is 40,000. And so we're actively working on that. So it's real important that we look at our surveillance numbers. Also, we work closely with Mexico. It's important for you to all know. Everyone says, well, it's the border and all that. No. We actually work with epidemiologists in Mexico through the state of Tamaulipas and the Secretaría de Salud. And we actually know their numbers. They know our numbers. We know what they have. They know what we have. We exchange data every week, all our numbers for all illnesses. So we actually are very up to date with what they have. They're up to date with what we have. And we exchange those ideas because we're a very fluid border. So it's very important. Now, right now, vaccine is readily available. Hidalgo County this year, of course, with Judge Garcia and the Commissioner's Court support, we took a very active campaign as part of our wellness program through the county to vaccinate our employees. Like I said, we in the county have actually vaccinated over a third of our employees already, and we're going to continue a second round of vaccinations for our employees. If anyone's interested in obtaining vaccinations and for their employees or their group, they could get in contact with us at 383-6221 Hidalgo County Health, or get in contact with your local insurance provider within your business or within your organization to see about getting a vaccination program for your staff.
No, except to, you guys remember the data that you were given is as of the end of November. Am I correct?
That's correct. True now.
But if there are no other questions, we want to thank you for being here. And as you can see, the county's in good hands and with our health director, Mr. Eddie Olivarez.
Thank you. Thank you, Judge.